Howdy, friends. Welcome back to East Texas Now, and join with us here at the desk, Dr. Levi Embry with the Embry Animal Clinic. We're talking about a big, teeny tiny parasite that can actually impact all of us, humans, but also our animals. And I've actually never heard of this. I think I heard about it in a cartoon once, but we're talking about giardia. Can you explain to us exactly what that is?
Yeah, it's a protozoa, and so it's an intestinal parasite of sorts, and so it can really it usually sets up shop kind of in the upper GI tract, the duodenum. So there's several species of giardia, but the one that affects mammals mostly is Giardia duodenalis, and that is named after the duodenum, the upper part of the GI tract where it infects, and yeah, it can infect dogs, cats, people, but they do vary. They vary somewhat, but they're all the same species.
Okay. So how does one come in contact with this parasite?
Yeah, usually it is what they call a fecal-oral route of transmission, which
Oh,
is
that's
what it
not
sounds
fun.
like, right? Yeah.
Yeah.
So there are two forms of the parasite. One is active inside, and then as it comes out of the animal, it's a cyst basically, and that's the
Oh.
infective stage. Is the cyst. The cyst can live outside in the environment for months, especially in more humid, wet environments. And so, when a dog eats either some fecal matter or something that has been in contact with fecal matter, it can infect itself.
So we're thinking like very moisture-ridden locations like rivers, lakes, that kind of thing. I heard maybe standing water could be an issue too.
Yeah, standing water that's the classic.
Right.
That's a classic storyline. Yeah.
Okay, so I mean, of course, we live in an area full of lakes and rivers and everything else, so this might be hard to avoid. Is there anything that we can do in advance to protect our animals? Of course, I'm sure there's like maybe a vaccine or something or a shot.
So there has been a vaccine in the past. It's not commercially available any longer. It did not actually prevent the dog or cat from getting giardia. It prevented shedding.
Oh.
So it was used in like shelter situations during outbreaks to cut down on animals that are infected from shedding it and spreading it elsewhere. But again, just because of its very limited practicality in that regard, I don't even think they manufacture it anymore.
So when it comes to prevention or maybe how to treat this, if my dog does contract giardia, what is the next step?
Yeah.
Is there signs that I can look out for? Do I immediately need to go to the vet? What's the steps there?
Well, I've never seen a dog that was brought in for giardia, right? So they're always brought in for diarrhea.
Okay.
Sometimes they can have vomiting, usually not. Sometimes they can be somewhat lethargic, usually not. Usually it's diarrhea, pretty severe diarrhea, typically. But otherwise, the dog or cat may feel kind of okay. They can. A lot of times they'll still have an appetite. In more severe cases, they may not. They may be anorexic, not wanting to eat, or lethargic. But in most cases, they're not lethargic, and in most cases, they're still eating, and they'll just have severe diarrhea.
Okay.
And usually, and that's what we treat for, or that's what we see. And so, it's going down the diagnostic pathway that we say, that we find giardia and then treat that.
Okay, so some of the signs, I'm sure some people would maybe confuse it with parvo, because you mentioned the vomiting, but the diarrhea I think would be of concern. So once you get to the vet clinic, what treatments would you? I mean, obviously you're treating the symptoms at that point.
Yeah, you treat this. You do treat. Typically in a giardia case, you would treat symptoms. You would treat the diarrhea symptomatically, but then you would also use a combination of 2 dewormers.
Okay.
To kill the giardia.
Okay, and I know you mentioned, cats and also dogs. Is there a specific species that is more common for them?
We see it more in dogs than we do in cats.
Okay.
Yep.
Okay. Now, we talked about treatments. We talked about you mentioned the 2 dewormers. Is that a long process? Is this something that you have to come back to the doctor for or the vet?
Yeah, most cases about a week.
Okay, so it's like a week-long process to treat and take care of. Do you think this is avoidable, or is this just like nature for dogs to come in contact with this?
Yeah, I think it can be. There are some things you can do to kind of avoid it. Clean drinking water for your dogs, keep them out of, all of that. Um, but usually it's something that, when you find it, you treat it and move on.
Is this something that's very common though?
Probably more common than we realize.
Okay.
It is a little bit difficult to find the giardia on a like a fecal flotation or something like that, and so historically, especially, it was kind of difficult to find it. There has since come out with a test called an ELISA, which is a enzyme-linked immunosorbent assay. It looks for specific protein,
Okay.
and that's available in most vet clinics now. And that is usually where you'll end up finding it. Historically, they used to have to rely a lot more on just seeing it under the microscope.
Okay.
Very difficult.
Yeah.
And so,
I can imagine.
yeah, and so we're finding a little more of it now. And so, but even with that, I still think we probably see more cases than we realize.
Okay, so the key signs that we're focusing on is they'll still have an appetite, but we're seeing
Typically.
not the best bowel movements.
Yeah, especially if it's like, we talk about water hose diarrhea.
Oh, goodness.
Often that case, not always that bad, but oftentimes, yes. Very
Yeah,
bad.
and that can be an issue, of course.
Yeah,
Is there
not
anything
fun.
we haven't really touched base on regarding just preventing, treating, and I guess knowing when giardia strikes?
Yeah, I think that one thing to be aware of if you do have a dog or cat or that gets diagnosed with giardia is that it does have zoonotic potential. So
What's that mean?
people get giardia as well.
Oh, love.
And so probably it happens. People pick it up from their pets less commonly than we probably used to think,
Okay.
because there's different subtypes that affect people compared to what's commonly found in dogs and cats. But it can happen, and so just be aware of that. Wash your hands well, use good hygiene, all of that.
Wash your hands.
Yeah.
Okay, you got it.
Yeah.
Well, I do appreciate you coming in. Again, this is Dr. Levi Embry with the Embry Animal Clinic. Where can we reach out to you if we have more questions regarding this specific situation?
Yeah, you could just call our clinic.
Call your clinic. What's your phone number at the clinic?
903-630-3352.
Perfect. Thank you so much for stopping in, talking to us about this,
Absolutely.
and of course, keeping us educated on how we can take care of our animals.
Absolutely.
Thank you so much, Dr. Levi.
You're welcome. Good to be here.
Oh, thank you. All right, here we go, friends. Let's turn now.